kind of funny, really. We're generally pretty good about getting to the dentist at least once or twice a year. But what about our eyes? If you ask most people, sight is the sense they would least like to lose, yet our eyes don't always get the love and attention they deserve. Our next guest is an expert in midlife eyes, where she's not only built a practice around improving people's precious sight, but also the successful treatment of dry eye, which does plague women in our age group. Listen to this episode where we discuss the causes and treatment of dry eye, strategies in addressing midlife sight, and cosmetic options for helping our peepers look their best. Health, wellness, career, family, life, and the better side of 50. I'm your host, Michelle Folan, and this is Asking for a Friend. Hello, listeners. Our guest expert today is an optometrist and entrepreneur. Dr. Carly Rose graduated from the Illinois College of Optometry and then did a year-long residency with the VA. She is also a fellow of the American Academy of Optometry. Dr. Rose is a sought-after speaker, in particular on the topic of dry eye and preventative eye health, and she is currently the owner of Clear Eyes and Aesthetics and the optometric practice Eye Care on the Square in Cincinnati, Ohio. Welcome, Dr. Rose.
Thank you, and thank you so much for having me. I'm super excited.
So I still have some connections in the eye care world based on one of my previous positions. When I was asking around, your name came up first in regard to the topic of dry eye. Kudos for you.
Thank you. Dry eye is a huge deal right now, and I'm super passionate about it.
When I was asking my listeners about topics, dry eye was the first one to come up. So that's why I wanted to hit this one first. And can you just explain for our listeners why dry eye is such an issue for women in this age group?
Yeah, let me first start by just an overview of dry eye. So I know a lot of people that don't experience dry eye. It is almost like, why is that big of a deal, right? So just put some eye drops in and go on with your day. But it really is more debilitating than that. So there's even a study that shows that having dry eye affects your life more than a fractured hip. So it's really a big deal. A lot of my end stage dry eye patients are on disability because they can't work. And I have a few patients that it gets so bad, their mental health is severely affected. It affects every aspect of your life. I always want to lead with the fact that it is a really serious eye disease that I want everyone to take seriously. So what dry eye is it could be anything from meibomian gland dysfunction to ocular rosacea to a Sjogren's like autoimmune disorder. And the hallmark of dry eye is that it's chronic and progressive. So if we don't intervene, it does get worse. And that's when we start to have these corneal issues where it can really affect your vision. A lot of people don't realize that. And it can start to develop neuralgias to where you almost have this stabbing pain in your eyes constantly. It is a multifaceted, very complex condition that as we pull back the layers, there's so much more to uncover. And it's estimated that over 30 million Americans have it. It's probably closer to around 60 million, which is more than all of glaucoma and macular degeneration combined. So it's a really big deal, and not a lot of people are doing anything about it. So that's why I'm so passionate about it.
And I love that. So it's not just a hormonal change issue for women.
Well, it's a piece of it. So one of the buzzwords is multifactorial, which means it can be hormonal, it can be lifestyle, it can be exogenous. So different things like glaucoma patients are on glaucoma medications that cause dry eye, or say you are on high blood pressure meds. High blood pressure meds can cause dry eye. Hormone imbalance, autoimmune disorders, thyroid problems, incomplete blinks, There are so many pieces of the dry eye puzzle, which makes it actually really tricky to treat because we have to figure out what's causing your specific dry eye and then tackle those issues. We have to do a lot of investigation. One metaphor I use a lot is dry eye is kind of like being in a boat with a lot of holes in the bottom of your boat. And we have to find all of your holes and plug them all at once to get any kind of relief. It's really tricky because we usually have to do a lot of treatments and therapies all at once, which can be really overwhelming. But multifactorial, so absolutely hormonal, cosmetics, and I know we're going to get into this a lot. So, cosmetics and aesthetic procedures and all of these things can cause dry eye, including, we haven't even talked about this, there's a lot of research starting to come out about breast implants can cause dry eye. It's almost to the point where what doesn't cause dry eye is the better question.
That is a really interesting comment about breast implants and dry eye. And is it because breast implants can possibly cause some autoimmune type of response?
Exactly. There's this whole idea of something called breast implant illness, which really does manifest as an autoimmune condition. And one of the most common symptoms of breast implant illness is dry eye. There's only one peer-reviewed study that I can find about it right now, but I know a lot are coming out, but it's so common at this point that I ask about it on my patient intake forms.
That's really interesting. I think for those of us that do have dry eye, mine usually presents with feeling like I've got a piece of sand in my eye. It's hard to drive. I've actually seen you as a patient a while back. There are things that we can do for it, but how do you typically diagnose? Because I know there's a lot of ways to diagnose this.
I have a lot more technology than most people have even ever heard of. My dry eye workup is pretty extensive. I do something called mybography, which is an imaging, it's a picture of your oil glands. Everyone has 60 to 80 oil glands in their eyelids, and they open at the lid margin. And so the purpose of these oil glands is every time you blink, the gentle pressure of the two lids touching should easily squeeze oil out and lubricate the surface of the eye. Around 86% of all dry eye results from an oil gland problem. So that's a huge piece of it. And then I also do all kinds of corneal imaging. I can do oil film assessment of your tears. I do something called osmolarity, which tests the salt content in your tears. I do MMP9 testing, which tests inflammatory markers in your tears. There's a lot of diagnostic tests we do to try to pull out what is causing your specific dry eye.
In terms of treatment, what is the first step you usually take with a patient?
Treatment is another complex beast, and there's usually not one monotherapy. So there's almost never one set thing that we can do that's going to fix all your problems. Unfortunately, that would be amazing. What I always recommend everyone to do, almost preventatively, even if you don't have dry eye, is blink exercises to keep those oil glands pumping, a great lid wash, a high quality omega supplement, and then hot compresses. So, heat, fish oil, blink exercises, and omegas. I look at those as a home therapy like brushing and flossing twice a day. These are things because almost all of us are looking at screens all day long, so we're not blinking as well as we should. And we're not cleaning our lids as well as we should. And we're getting this stasis just by a product of our environment. So, preventatively, I think everyone in the world, if that will listen to me, should be doing heat, fish oil, blink exercise, lid wash. So, that's always where I start. And then we have a whole host of pharmaceuticals. At this point, I think everyone's heard of Restasis, but we have a lot more options beyond just Restasis we can do. Some of my favorites are actually in-office procedures. We have intense pulse light, which is a photofacial that was actually developed in dermatology around 50 years ago. So this is the piece of equipment that actually had me cross over into the aesthetic world. What happened is I had been reading all of this research about how IPL is helpful for dry eye. And the story is that around 20 years ago, an ophthalmologist in Tennessee was using IPL on his rosacea patients on label. And they were coming back to him after so many series reporting that their dry eye was getting better. And now we have over 100 peer-reviewed studies showing what this is doing. And what IPL does at a certain setting with a certain protocol, usually 4 sessions, 2 to 4 weeks apart, it helps decrease the bacterial load in your lids and lashes. It decreases inflammation in your tears. It increases your oil gland structure and function. It tackles dry eye from many, many different angles,
Interesting.
which another side effect is that it helps reds and browns, right? So it was developed to treat tone of your skin. And so you also get that benefit. And then there are thermal evacuation procedures. So I mentioned that the oil gland blockages is a big, big piece of the dry eye world. We have multiple different ways to evacuate those oil glands, get the clogs out of there. There are lots of procedures. We have at our disposal many different options. We have something called LipiFlow, which is a 12-minute in-office automated procedure that heats and evacuates the oil glands. We have another device called the iLux, which does something very similar, but it's more customizable. It's not the automated procedure. It is, we really treat the lids specifically, and we can look through a viewfinder and watch what your oil glands are doing. And then the most exciting piece, the newest piece of technology with this oil gland evacuation world, is radio frequency. Radio frequency is another device developed in the aesthetic world that has this off label crossover into the dry eye world. So it does heat and pressure just like the others, but it was developed to do skin tightening.
Oh, sign me up.
Exactly. It's really been a fascinating world. We mentioned how blinking is an important piece. There are a lot of patients that have a poor lid blink because they have a poor lid apposition. The lid is not positioned to the eyeball, the globe, like it should be. So you're not going to get that tear film distribution that you need. So if we can tighten the lid back up against the globe, it's going to give us a better lid structure, and it just all goes together. It really all goes together.
I'm sitting here blinking
Yeah.
because she keeps saying blinking. I'm like, oh God, I don't blink enough. But we're all in front of
Mhm.
our computers all day and our phones. It's a really good reminder to make sure we're blinking. So I appreciate that.
When we look at screens, we blink 75% less than we should. And so we're training our blinks to go away. We're training our pumps to stop working. And so, if anyone, and this is all of us, if we're on screens, we should be doing blink exercises.
If we're blinking less, does it make the oil in our lids more viscous?
Yeah, it clogs them. You're exactly right.
Okay.
It gets really stagnant. And then the problem is that there's this back pressure because the oil's not being released, and those oil glands will permanently die off. This becomes a permanent anatomy change that we're trying to prevent.
Okay. Now you're scaring me. I'm like, oh no. As we get off the phone, I'm making an appointment. I gotta come in and see you. Anything else on the realm of dry eye before I move on?
That's a big world. I could talk for 4 more hours about it, but that's a good overview.
Great. The next one is vision changes. There are many of us that have to wear readers, bifocals, whatever you want to call them. I know some people may use contacts as a strategy to avoid glasses. Can you talk about that a little bit?
Absolutely. Okay, so anywhere from 38 to 42 is usually the realm that our near vision starts to decrease. That's called presbyopia, and that is essentially the focusing muscle in your eye just gets weaker every year. This is a naturally occurring event. And so of course, a standard option is reading glasses and or progressive glasses, but a lot of great options are contact lenses that people don't even think about, especially people that have never wore glasses in their life and then need readers don't even think contact lenses might be an option. We have at our disposal different multifocal options to where both eyes have in the contact lens correction for distance and near reading. And that plays on your pupil size. And so when we go to read, our pupils change size. And when it does that, it gets into a different power zone in the contact lens. And then a second option is something called monovision, where one eye is set for distance and one eye is set for near. And in theory, over time, your brain picks which one it wants to use to do that specific task. Now, both of those options are not super cut and dry. And the fact that to know if it's going to work for you, really the best bet is trying it. So, what you would do is go to your eye care provider. You would try the contact lens in office. They would try to get as close to perfect as possible and then send you home with it because there's this adaptation period. And some people love it, some people hate it, but it's usually a fantastic option outside of just traditional glasses.
How long is that adaptation period?
I usually tell people give it a good 3 to 5 days. However, it does change year to year. What I find every once in a while is if a patient can't get used to it 1 year, the next year their near demand typically increases, right? So our reading power will go up every year until you hit a plateau. And what I find is sometimes when that near demand increases and you almost need it more, it's easier to adapt. So I always offer it as an option, even if you failed in the past.
If you have dry eye, however, are you going to be a candidate?
That's exactly what I was just going to say. The number one cause of contact lens intolerance is dry eye. I don't think that would eliminate you. I would just aggressively treat the dry eye and make sure we can hit your life goals. If your life goal is to be successful in contact lenses, then we can do that.
All right. And then I saw, actually, my sister asked this question, saw a commercial for some drops that actually work to help with presbyopia. Have you had any experience with those yet?
I have only had a handful of patients interested in trying it. There are, of course, pros and cons. The biggest cons are that it usually only lasts a few hours for patients. So the question is, how long can we safely use these? There are not very long-term studies of this medication. And if it's something that you want to use to get out of readers, my question is, how long is safe? Number one. And number two, it is linked to an increase of retinal detachments, actually. So the workup would look like a pretty extensive retinal workup. And when I present that to patients, the risk usually outweighs the benefits, even though it is still a low risk. Any retinal issues are a really big deal. And usually patients would rather just try a multifocal contact lens.
Or
Or
glasses?
glasses. Exactly. Exactly. Now, I will say I do know that there are other presbyopic drops coming. So I'm still optimistic that we're going to have options. We'll see. We shall see.
All right. The next topic was cataracts. And it's like, it's such a downer thing to have to talk about.
Not so cool topic. Yeah.
But again, got a specific question. The question was, when do you start treating? One of our listeners was just recently diagnosed with a cataract. She didn't even know it was there, but she went in for her annual eye exam and they saw it. She wanted to know, how quickly do they grow? How do you typically diagnose them? And then is she going to automatically have an issue with her other eye?
I will say yes, she'll automatically have an issue with her other eye because she's human. So cataracts are kind of this human experience. It's almost like a goal to get to the point of being able to have cataracts, right? It's a process, it's an aging process that we all get to eventually. So you don't want to not be able to get there, if that makes sense.
Right.
It is an aging process, not any kind of disease process. If you imagine, when we're born, the lens of our eye is crystal clear. Just over the years, with sun exposure and toxin buildup, it gets yellow and cloudy over time. Similar to where if you put a piece of clear plastic in the sun for 50 or 60 years, it gets yellow over time. When it gets so yellow or cloudy that it blocks your vision is when we usually do something about it. And there are a few different ways we essentially test this. Is obviously I recommend everyone get annual eye exams, and this is where we uncover these things. We can look in the slit lamp and the microscope and physically see the cataracts. And then we can also start to test how that's affecting your vision with your typical acuity test that you're used to. And then there are also different light induced acuity tests we can do if we're really starting to question if you should have surgery or not. We can do a brightness acuity test to kind of tease out how symptomatic you are from this. But it really is almost patient driven. I have a few patients that are 20, 30, 20, 40, and not too bothered by their cataracts, and to where I have no problem monitoring them once a year unless they tell me. I educate the patient and say, in 3 months, if you're like, this is driving me bananas, I can't drive at night anymore, that's okay. Let me know sooner and I'll get you in touch with the surgeon. However, if you're fine with it and I'm fine with it, then we can just monitor this because it's not a disease process. Now, when the eye care provider would recommend surgery beyond the patient's symptoms is when they are so cloudy that we can't view the back of the eye safely. So as long as we can see enough through the cataract to be able to monitor things like glaucoma, macular degeneration, diabetic retinopathy, as long as we can see the back of the eye, then I have no problem monitoring for symptoms.
Okay.
Does that make sense?
Yeah, it does.
Now, what can prevent them? I often say anything that keeps you young and healthy keeps your cataracts slow growing. So, cigarette smoking increases cataracts, diabetes increases cataract formation, oral steroids. And sometimes we can't get around that, right? But steroids, nasal steroids, those all precipitate cataracts quicker. And then sun protection is huge, those slow cataracts. So, sun protection is also going to be good for the eyelids are the most common area on the body to get skin cancer. And I know we're going to touch on things like hooded eyelids and wrinkles. Sun protection is going to help all of that.
Yeah, we all know that too. We just don't always pay attention.
I know.
All right, that was great on cataracts. I appreciate the detail on that because I know my mom had them, and I remember going and taking her to the surgeon and waiting with her. And that whole process freaks me out. So I really not looking forward to that, but it's inevitable, right?
Cataract surgery is the most commonly performed surgery. They're getting really good at it. It's not without risk, but it's not one to be super afraid of either.
Okay. All right. I'll keep that under advisement. All right. So the fun stuff
Yes.
that I really wanted to cover with you is aesthetics. And I know a lot of optometrists now are getting into aesthetics because there's so much new technology out there for you all to be full service for your eye patients, which I think is fantastic. Just tell me a little bit about what you're doing there at your practice and some of the new technology that you've got.
I've actually known for a really long time that I love dry eye. It's the aesthetic piece that actually threw me for a loop. When I was talking with these companies that have these aesthetic side effects, the sales reps are talking to me about it. And I'm like, yeah, I don't really care. Tell me everything about dry eye. That's what I want to do is dry eye. And what I found in practice is that patients are curious, so I need to learn about it, right? I need to know, okay, so what settings do lift the brown spots? What settings help with the redness? How is this tightening the skin? And then there are so many things in the aesthetic world that cause dry eye. So I had to learn about them. So, for example, crow's feet Botox interrupts that blink, so that can cause dry eye. Lash serums specifically, or lash extensions, or fake lashes, or waterproof mascara, all of those things cause dry eye. So I need to know healthy, safe alternatives. So I had to learn about all of this because at the end of the day, the eyelids are an extension of the skin. It all goes together. So I started down this rabbit hole of learning about aesthetics and skincare and these procedures and how they can either help or hurt dry eye. And I realized there's really no way to separate them. I need to be able to suggest healthy lash serums for patients or healthy lash treatments for patients or alternatives to crow's feet Botox or upper eyelid surgery can cause dry eye. So, what are some alternatives specifically for my dry eye patients that still want to feel good about themselves. And that's where things like radio frequency or microneedling come into play.
Okay. I'm checking off a lot of boxes here. All right, let's start with the eyelash thing. I don't do eyelash extensions, but I do an eyelash serum, particularly after having gone through menopause last year because I had a hysterectomy. My eyelashes just started to go away. What are healthier alternatives for eyelash serum?
So the biggest ingredient in eyelash serum that cause dry eye is prostaglandin analogs. Those are very, very frequently found. Latisse and Lash Boost and most of the common ones on the market have prostaglandin analogs. And the reason these cause dry eye is because they are pro-inflammatory agents. They work really, really well, but they cause inflammation. And at the root cause of most dry eye is inflammation. And that's what I'm tackling against. And so if you are trying to limit your dry eye, it's like putting gasoline on a fire. You're adding an inflammatory agent to the surface of the eye. What you want to look for in a lash serum is you want to avoid prostaglandin analogs. And then there are plenty of lash serums on the market that are really nourishing. So they would have good oils in them and peptides and maybe botanicals that help grow the lashes instead of the prostaglandin analogs. And then another biggie for growing lashes in a safe and healthy way is a great lash cleaner. So one of my very favorite lash cleaners is called We Love Eyes Oil and Foam. To keep a clean, healthy lash is going to promote growing. Also, clearing off the makeup. All of these things really do help the lashes grow naturally as well.
Okay. This is really good stuff.
It's fascinating stuff, isn't it? When I first present the idea of dry eye, everybody's like, oh, it's so boring, but it's really, really cool. It's not boring at all.
If a patient comes to you and they've got some Mac Daddy eyelash extensions, first of all, that's not good for their lashes because they typically fall out when you take those puppies off. What do you typically say to that patient? Because you know they love them.
Well, I'm a big fan of your body, your choice, and it's just a matter of educating. As long as you know the risk and you're okay with it, then that's completely your choice. Now, the risks are quite a few. With lash extensions, the adhesive can be very toxic to the surface of the eye and those oil glands that we're trying to preserve. And then one thing that a lot of people don't think about is it can interfere with the blink rate. And so if you can't close your eyes all the way, those lids aren't able to touch and the oil
Mm.
glands aren't getting the stimulation they need. Additionally, we all have this skin bug on our lashes and brows called Demodex. It's this little parasite that is an opportunistic infector. And so basically, lash extensions are kind of like mansions for Demodex. They love it and they get really overpopulated and cause all kinds of damage. There are quite a few things involved with how they can damage your eyes. Now, I have a few patients that are essentially required to wear lash extensions for their careers. And it's just like if I had a patient that has to work on a computer screen for their job, it is a part of their life that we have to work around. The workaround is in between sets, we do an in office deep clean, and that helps a lot.
Okay. You were mentioning how things like Botox can also add to the dry eye issue. And then you were saying that you have some other things like radio frequency, some things like that that can be alternatives to that. What about the hooded lids?
So the radio frequency can help with that as well.
Okay.
It's just going to give you more like a couple millimeters of lift versus a surgical outcome. There are ways we can test to see how visually impacting your hooded lids are. And sometimes it's more of a visual thing. It can actually block your vision. And so we may actually need to do surgery. It really just depends on the level of hooding, but absolutely radio frequency and microneedling can both give a good lift without the risk of surgery causing dry eye. So the blepharoplasty has a risk of causing severe dry eye because if they take too much lid skin, then your lids aren't able to touch. And some of my worst cases are post blef dry eye. It can be a really big challenge. If I have a dry eye patient, I automatically recommend things like radiofrequency or microneedling as opposed to a blef. But if they truly do need a blepharoplasty, I only recommend certain oculoplastics surgeons because they know the eyelid anatomy more than just a facial plastic surgeon. So really you do want to go to an oculoplastic specific.
Okay, that's really great advice. Can you explain microneedling around the eye, what that would look like?
Yeah, there's a few different ways to do it, but essentially the theory is puncturing the skin to cause an injury to trigger a healing response to tighten the skin, right? And then we can also do things like microneedling with PRP, to where we microneedle and cause channels in the skin and then place platelet-rich plasma to help with stem cells and different growth factors. And then you can also do microneedling with radiofrequency to where you combine the two. And it's just a wild world, but there are quite a few options out there that will be less invasive than a surgical procedure.
Okay. In regard to future technology, what are you most excited about on the horizon for your practice?
It's been fascinating to watch. Just in the handful of years I've been really deep into the dry eye world, the diagnostic equipment has blown my mind. They are aggressively expanding the diagnostic world. We know more about dry eye now than we ever have before. Even when I was in optometry school, we knew nothing. We knew nothing about this. This is really considered a new disease because we're learning so much more about it. So I'm very excited about the diagnostics I see coming out. There are also a few pharmaceuticals coming out that sound pretty cool. And of course, the more we learn about from the diagnostic perspective, the more we learn about what is actually causing this disease, the better tailored we can do these treatment plans.
Okay. And then one of my last questions will be if you could mold your perfect patient, how often should I be coming to see you? What kind of questions should patients be asking their optometrist?
For the best recommendation for eye health, perfect patient, annual eye exams, sun protection, high quality sun protection too. A lot of over the counter sunglasses just have spray on tint, and that's not going to be protecting you. In fact, it can actually do more damage than wearing nothing. What happens is the tint can dilate your pupil, but then not offer any protection. So more UV light gets into your eye than if you were wearing nothing and allowed your pupil to constrict. So high quality sunglasses, annual eye exams, blink exercise, lid wash, hot compress, omegas, a great multivitamin to protect your macula, and don't smoke. Those are huge. Right there, you're going to cover the vast majority of the eye diseases.
Take note, listeners.
And then what question should you ask your eye care provider? Well, I think first and foremost, be really open with your family history and your medications. A lot of people don't realize how much of an impact your systemic health and your family history has on your ocular health. Things like diabetes, high blood pressure, anxiety meds, thyroid problems, cancers, anything that affects your whole body affects your eyes. So have an open conversation because it really can affect your eye health, number one. And then questions are always, of course, what am I at risk for? What can I do to prevent? What is the phrase? An ounce of prevention is worth more than a pound of treatment.
Right.
Yes, exactly. And so just having that conversation and trust in your provider goes a long way.
Great. This has been fabulous. If every woman listening to this isn't dialing the phone and getting in with their optometrist after this call, I don't know how better to impact people to become their own best advocate. So, Dr. Carly Rose, thank you so much for being here. I really appreciate your time today. I will put in the show notes how to get a hold of you, where your practice is. And then one other thing, if someone is not local here to the Cincinnati area, how can they best find a good optometrist?
Google reviews go a long way.
Okay.
That's a biggie. Word of mouth, talking to somebody that's been there. But go with your gut. If you go to an eye care provider and it just doesn't feel like you're connecting, that's okay. I fully get that I'm not going to be everyone's cup of tea either. And that's okay too. It has to be a right fit to build that trust year after year, because that's one thing I love about eye care is you can build these relationships because you do see the same patients year after year. We have fantastic providers in our office that feel the same way, and we love developing the relationships. It's okay if it's not the right fit, go see somebody else until you find the right person.
Great. Wonderful advice. Thank you again for being here.
Thank you for having me. This was great.
Oh, good. Thank you. Follow Asking for a Friend on social media outlets and provide a review and share this show wherever you get your podcasts. Reviews and sharing help us grow.